Calder, from a legal standpoint, what qualifies as long-term harm, and how is that different from a temporary injury and normal recovery?
Sure. So long-term harm is something that's going to stay with you for years, if not permanently for the rest of your life. That's different than bumps, bruises, broken bones that will heal. Talking about, permanent substantial injuries that are going to impact your life ongoing and oftentimes your daily life each day.
And how do you connect the dots between the event and ongoing symptoms, that may be happening months or even years later?
Sure. So it's going to come from medical professionals, both your current treating physicians who are going to talk about um, the cause and the etiology of your symptoms and conditions, and experts that are reviewing your medical records and what's going on with you and saying where this came from, when it arose. And on top of that, often common sense plays a role. I mean, if these are issues that you never had before medical treatment or an injury or accident, and now you do, now they're ongoing, it follows that they arose from that event.
And what role do specialists and maybe expert witnesses play in proving that, long-term harm and that causation between the event and what you're experiencing now?
Sure. So, like I said, the subsequent treaters, so the medical providers that you're seeing after this, that are treating you for those conditions, can often be the most important in showing this long term harm because they're documenting and treating and addressing those ongoing issues. And experts can then take those records, look at them, and look at your treating provider's prognosis and carry that out across the course of your life to show that this is going to continue. It's often going to get worse and progress and have more of an impact as your life progresses. The most common experts we'll see for this are physical medicine and rehabilitation experts, as this is their bread and butter. This is what they do on a daily basis, is treating patients with ongoing and progressing medical issues.
And how do you calculate damages for things like long-term harm? There's the medical costs. There's maybe a potentially a lost earning potential there. There's, like you said, the just the daily limitations of being able to go about your day and your activities, and pain and suffering, things like that. How do you go about trying to even start to calculate damages for something like that?
Sure. So the first place to start is with medical professionals and in the medical records. So that's looking at what your current conditions are. What current treatment are you receiving, and what current medications do you need? And looking at what is the treatment going to look like 1, 2, 3, 5, 10 years from now? Is it going to stay the same? Is it going to decrease? Is it most likely going to increase, needing more help, needing more medication? And both the current treating medical providers and medical professionals that do this on a daily basis will be able to say that and document that and explain that to the jury. Then there's what's called life care planners, who help with care planning of patients, and they'll look at what the medical providers are saying, what medications are being ordered, what treatment is being ordered, and what will be needed, what assistive devices maybe will you need. Will they need a walker? Will they need a different type of transportation or car? Will they need, more assistance, like in a home health aid in the future? And they take all that and they look at how much those services cost and compile those costs both for now and this year and the present, and then take those costs and carry them out across the future as to what they'll be for the remainder of the patient's life. And then on top of that, you have an economist come and look at those numbers and say, okay, here's what the treatment costs. Here's the treatment they're going to need. Here's what the number is. Here's how much a jury would need to award in today's dollars for this patient to be able to take care of themselves for their conditions and their injuries for the rest of their life.
Right, and that's figuring in things like inflation and the fact that all of those treatments are going to get more expensive as time goes on.
Yes, and putting it down into today's present value dollars so that the jury can award the appropriate amount.
What are some of the common defense arguments in these types of long-term harm cases, and how do you counter those?
Sure. I mean, this is the area where the defense is just trying to save themselves money, to minimize the damage and harm that they've caused. They'll say that these injuries or conditions maybe happened before the event or happened from some other event or some other cause, and come up with any and all reason that they should not be the ones held responsible for causing these conditions. They'll also try and get down in the weeds and argue over, well, they might not need this medication, or they might not need a health aid, 24 hours a day. Maybe they can only do one 8 hours a day, just to try and save every last penny, and fight for every last dollar.
And so, what do you do in those cases? Is it just a matter of, like you said, bringing in those expert witnesses and things like that in order to show that no, indeed, this is a really serious situation with this patient, and these are the real dollar amounts that they're going to need moving forward?
Yeah, I mean, I think it's a lot what you just said, and bringing in the experts, having them explain to the jury. But I think the most important thing that we always try to do is be honest and transparent, both with the jury and through our experts. We're not making claims for things that, they only might need or kind of need, or throwing things into these life care plans or trumping up the damages or cost. We try to be as honest and transparent as possible with the jury to say, look, here's their condition, here's what it costs, and this is the number. It's not inflated, it's not blown up. We're not throwing things in there, so that at the end of the day, you can be sure you're holding the defense accountable, and you're only holding them accountable for the damage they caused.